Good evening and welcome to Talking Points. I'm Esme Murphy. Happy New Year. Just don't drink to it is what the U.S. Surgeon General report says. Less than one drink a week for both men and women over a lifetime can increase the risk of 7 kinds of cancer: mouth, throat, voice box, esophagus, breast, liver, colon, and rectum cancers. What is startling is the warning about how little alcohol it takes to up your risk. For women and breast cancer, less than one drink a week over a lifetime increases cancer risk by as much as 11%. One drink a day bumps the risk to 13%, and 2 drinks a day increases the risk to 15%. For women and men over a lifetime, the same number of drinks, 1 a week, 1 a day, or 2 a day, boosts cancer risk up to 21% for women and up to 13% for men. What are we to make of these new warnings? We turn to Dr. Silvia Balbo, a researcher with the Masonic Cancer Center at the University of Minnesota. And joining us right now is Dr. Balbo. Thank you so much for joining us to talk about this subject that has, I think, caught a lot of people by surprise. I think what I found so surprising about this study is that such a little amount of alcohol taken per day, or even less than a day over the course of a lifetime, can really substantially increase your risk. Why is that?
Yeah, so the studies have shown that specifically for breast cancer, oral cancer, or mouth cancer and throat cancer, there is this significant increase of risk already for 1 drink per day or less of alcohol consumed. The research has been very, very robust, and it's been done in different settings in different areas in the world, and it really points to this risk being associated with even these low amounts of alcohol.
Right. And I guess that's a good point, that there have been studies in the past that have also looked at this and come to the same conclusion. It's just the Surgeon General suggesting that maybe warning signs should be on bottles of alcohol caught a lot of people who are not scientists or researchers by surprise.
Absolutely. The important thing to remember is that the Surgeon General report is really taking into account all the research that has been done in this space and really bringing to the attention of the American public the robust studies and the findings that are the most reliable. Okay. So it's not the Surgeon General making these studies or seeing these associations. Is really an analysis of all the research and all the science and the best scientific evidence that is available at the moment.
Okay, and the phrase that that this study uses a lot is over a lifetime. Mm-hmm. Why is that so important? Like, for instance, 1 drink a day over a lifetime raises a woman's risk of cancer 19%, and for men it's 11.4%. I want to ask you about that difference, but what is over a lifetime? I mean, a lifetime of drinking, 30, 40 years?
Yeah, so the reason why we're referring to this in this way is that the studies that have been conducted have really followed people drinking and their drinking patterns over a long time. And because cancer is then being detected later in life, we are looking at what is the effect of that long-term consumption. Unfortunately, we still don't know if drinking early in life in the adolescent period, or drinking, binge drinking, or drinking later in life has the same impact. And so the evidence that we have at the moment is really looking at what happens when people are reporting their drinking over a long period of time.
Okay, and I want to ask you about that, but first I want to get into why are these risk factors for 1 drink a day, 2 drinks a day higher for women than they are for men?
It's because this is related to the fact that this association and this increased risk for lower amounts of alcohol is pretty clear in breast cancer, and so clearly this is something that is relevant for women.
Okay, so that's the main reason why. Is it anything to do with the fact that I guess women metabolize alcohol differently?
It's more related to a mechanism that is operating through the variations of the hormonal balance. And so even though we are still trying to really figure out what are the mechanisms that are connecting alcohol consumption with cancer, it seems like in the case of breast cancer, really the interaction with the hormones is what is playing a role.
Let's go back to the over a lifetime. You were talking about, for instance, young people binge drinking and drinking at different points in your life. If you drank a lot as a young person and then perhaps stop when you're 40, does that bring your risk back down?
So we know that there is a dose response, meaning that the more you drink, the higher the risk. So it's reasonable to think that if you stop drinking or if you reduce that consumption, you will have a lower risk. Unfortunately, the research that has really looked into what happens when you stop is really limited. And so we have recently reported on the fact that if you reduce or stop drinking, your risk for esophageal cancer and mouth cancer will drop and will reduce, but we don't have the data
for the
other cancers and to really understand what is the effect of binge drinking versus other ways or other styles of consumption of alcohol.
Do you think it would be a good idea to have warning labels on bottles of alcohol?
I think so, because the reason why this report has sort of came out and is so important is that it's still clear that less than 50% of Americans know about the connection and the risk that comes from drinking alcohol and of developing cancer. And so clearly there is a lack of awareness. And I think that it's important for the American public to be informed so that they can decide if drinking and the way that they're drinking is good for them.
You know, this talks about, the whole thing is about risk factors, and I think most of us are used to hearing about risk factors. Let's talk about breast cancer, that if your mother had breast cancer or your sister had breast cancer, that you're at risk or at a higher risk. Does the drinking alcohol compound the higher risk that somebody might have with a genetic risk?
Absolutely. So the idea here, again, is that by making sure that people understand that there is a risk associated with drinking, especially if they have other risk factors, then they can decide whether drinking is a good idea for them. So if you have some genetic factors, if you have factors or risk factors that you cannot really modify, drinking alcohol is where instead you can have a way of deciding whether it's good for you or not.
You know, when you look at these numbers, I'm sorry, this is kind of scary. I mean, I would think that people, if they read this report, might actually not drink. I mean, should people stop drinking?
I don't think that the report is about a ban on alcohol or just alarming people. It's more, again, about increasing the awareness of Americans and making sure that people that instead have specific conditions or have risk factors that are coming into play and are not modifiable are aware of the fact that when they drink, they may have an increase in the risk.
And I didn't see any breakdown in terms of the kinds of alcohol here, because we've heard about those studies, and I think that's what's so confusing with people. People hear these studies that maybe it's good for you, maybe it's not good for you, the red wine's good for you. I don't see anything in this study about certain types of alcohol being better or worse than others.
That's correct. So in general, all the studies have shown that the risk is associated to alcohol consumption no matter the type of drink or the type of alcoholic beverage that you're consuming, meaning that it really comes down to the ethanol that is present in each of the drinks, being beer, wine, or a hard liquor. So there is not a clear connection with the type of beverage and an increased risk of cancer. Is really just the amount of alcohol that one would consume.
Okay. I guess some people might wonder, is there any research being done on anything that would block that absorption so people could still drink?
There is some research in that sense, but there are also other things to consider. There are cultures where wine or alcohol is consumed with food. Food reduces the absorption of alcohol. There are ways of drinking with also drinking a lot of water, and we know that reduces the again the absorption of alcohol. So there are ways of consuming alcohol in a better way, let's say.
So eat a lot of food.
Yes, enjoy that glass of wine with good food. I think that's definitely a better way of enjoying that glass of wine rather than having a drink without any food.
And are there more studies that are going to be coming out on this issue of alcohol and risk factors? Absolutely.
This is a very active area of research, and I think that especially the findings that are summarized in the Surgeon General report are prompting and pushing for even more to be done. Certainly my lab is working hard on this
that
topic.
Okay. Well, we'll be looking forward to that, definitely. Dr. Balbo, thank you so much for joining us. Really appreciate your insights.
Thank you for having me.
Absolutely. And that does it for this edition of Talking Points. As always, please email me with comments or suggestions at esme@wcco.com. Talking Points posts to the WCCO YouTube page every Thursday. Thank you so much for watching. I'm Esme Murphy, WCCO News.